Hey everyone, it's Dr. Hodges. I wanted to talk a little bit today about strength training and what you can do to gain muscle. I have a lot of patients that, especially my male patients, they do have a concern that will they, number one, lose muscle mass after surgery, and will they ever be able to gain it back? And I think the reality is that anytime that you're doing a weight loss program, the risk for muscle wasting is there. That's one of the reasons why we so strongly suggest that you keep up with your protein intake and supplementation after weight loss surgery. But whenever I'm talking with my patients and they want to start a strength training program, I think that there are kind of three key elements that you need to keep in mind. Number one, when you're beginning a strength training program, you need to give yourself a little bit of rest in between the sessions. So a lot of people recommend that you'll do one body part one day, or so like upper body one day, then lower body, give yourself a day of rest, and then lower body the following day. Or if you're going to do a full body workout, again, give yourself a day of rest in between. And I certainly agree with that. I've noticed that whenever I'm doing just my cardio workouts that I really seem to be much more fatigued at the end of the week since I'm really out of shape. If I try to go every day, I'm really just myself trying to get the stamina. So for now, I'm just working out every other day. So that would be number one. Number two, I think it is imperative if you're a weight loss surgery patient, and you're trying to gain muscle, that in addition to actually doing strength training exercises, you must make sure that you keep up with your protein supplementation. You need to, number one, take the bare minimum recommendations, and then number two, add to it. So for instance, if you've had a sleeve or a bypass, you need to be doing 60 to 80 grams of protein supplement a day. I probably recommend more on the higher side, for the baseline being 80 grams. And if you've had a duodenal switch or a malabsorptive bypass, I'd recommend that you do 100 to 120 grams a day. Now, if you're wanting to bulk up and get that extra muscle, the only way that your muscles are going to grow is if, number one, you strength train, but then number two, you feed them. So in addition to your baseline protein, I recommend that you do an additional 30 to 40 grams of protein supplement in addition to your baseline. I had one patient who had lost all of his weight, and he'd had a gastric bypass, and now he was working with a trainer, and he roughly weighed about 150 pounds, and he actually took in 140 to 150 grams of protein supplement in a day, and that was in addition to the foods that he was eating. And it was interesting, he didn't really change his workouts, but once he started to up his protein intake, he really did see a bigger change in his muscle mass. So for all you guys out there that have had weight loss surgery, buck up, baby. You got to take in that protein. And then finally, I would say when you're taking in that protein, it's really recommended that you do an extra protein supplement about 30 minutes or within 30 minutes of your workout. So do your strength training, give yourself a day of rest in between, make sure you're doing your protein supplementation. And then finally, when you're doing a workout, if you want to add cardio in with your strength training day, it's actually much better to do your strength training first and then to do your cardio. And when you're doing your cardio, you take it slow and low. You want to keep that heart rate between 105 and 125. What you're trying to do is melt the fat. So if you want to get shredded, do the strength and then do the slow cardio. I hope that this has been helpful for you guys. If you found it helpful, give me a thumbs up, share it with your friends, and don't forget to subscribe. Have a good night.